Okay. Okay. So to start off, welcome. And could you tell us just a little bit about yourself? Who you are and what you're doing right now.
Sure. My name is Stephanie Holmes. I got my PhD from Oklahoma State University in school psychology. Obviously a graduate of Bucknell, which is how you found me. Professor Boyatzis was my honors thesis advisor, so I owe a lot of my career success so far to him. um, let's see. I got my degree in school psychology, and typically school psychologists, as you can imagine, work in schools, right? They typically have maybe 3 or 4 schools that they're in charge of in a school district. I'm kind of the atypical school psych. I am working in a clinic setting. I'm working at University of Florida College of Medicine in Jacksonville, Florida. So I really have a clinical psychology hat on. A school psychologist or a clinical psychologist would be appropriate in my position. So with the same degree, we kind of could end up in the same spot. So what I do here primarily is diagnosing. Children come in and adolescents. I'm sure you're familiar with the DSM-5 now. So I diagnose basically the DSM-5, autism spectrum disorder, anxiety disorders, depressive disorders, etc. So in addition to making the diagnosis, we also do a lot of trainings for the community, especially school districts, where we teach teachers about what these disorders look like. And then we teach them strategies to use in the classroom to help manage the symptoms. Let's see, what else do we do? And then we do a lot of consultations as well. So we have school districts call us with questions. I have this child who does this behavior. How do I handle that? So we do some consults as well.
Yeah. So what made you interested in going into school psychology and in particular working with adolescents and just kids in general?
I just have this propensity towards kids ever since I was little. I actually, what made me go into psychology was in high school, we had the opportunity to take an elective. So the elective I took was psychology. I fell in love with it. And so I was one of the lucky ones that before even graduating high school, I knew I wanted to be a child psychologist. I know that's kind of rare. So for me, the big decision was what type of psychology degree do I get? For me, I had narrowed it down to counseling psychology, school psychology, or clinical psychology. And really what pushed me more towards the school psych was, quite frankly, the lifestyle that it could afford me. I was thinking about having a family someday as a woman and wanting to be a career woman in addition to that, and having a school schedule would be the perfect fit. So that's what led me into school psych to begin with. Counseling psych for me was not as black and white as school psych. That was school psych to me at the time. Was what I knew about it was a little more data driven. But then here I am in a clinic setting and not even in a school. So yes, but that's what got me into school psychology was the lifestyle.
Okay. And what about some of the placements or internships you had during graduate school? Did any of those, help you decide what you wanted your career to be or things like that?
Oh, yes. During graduate school?
Yeah.
Oh, yes. During graduate school, from our very first semester, they threw us into the schools, and I was shadowing their school psychologist. So it was great because from day one, I got to really experience what it was like to be a school psychologist, and I loved it. But then as graduate school progressed, and then I think it was my third year, I was the school psychologist for a school. I became a little frustrated with having to follow the laws and rules of the Department of Education.
Mhm.
As a school psychologist, you often aren't allowed to actually make a diagnosis. In our reports, we describe a child's strengths and weaknesses, but we can't say that it's bipolar disorder or it's an anxiety disorder, etc. We just have to say this is where their IQ is and this is where their academics are, etc. And for me, it was frustrating because what the parents really wanted to know was, why is my child having this issue? So that kind of pushed me into wanting to work more in the clinical world, the clinical setting, where we have that freedom to make a diagnosis and to actually then treat. So yeah. So the practicum was very helpful for me. I would encourage you all, if you're looking at graduate school programs, to really weigh heavily their practicum experience that they will give you. Because you can only learn so much from a textbook, right? And experiencing it is just so enlightening.
So then did you end up going straight into clinical work once you graduated from grad school? Have you been in this position since grad school, or did you explore other options first?
This is my first job out. Yeah.
Okay.
I have to pinch myself that they hired me. I don't know why they did. But during my, if you want to be a licensed psychologist, it's quite a journey. You have to do your coursework, right? But then you have to also, like going out.
Sorry.
So you do your coursework, and then you have to do your year of internship, okay?
Mm-hmm.
And your internship year, it's encouraged to do an APA accredited internship. That's looked very highly upon. So the APA accredited internships are a match system.
Mm-hmm.
What happens is you get an email saying where you're going for your internship year after you've finished all your coursework of graduate school. My internship year, I got matched to Tallahassee, Florida. It just so happened that that particular site was perfect for me because half of the week I was working as a school psychologist in 3 different schools. And then the other half of the week, I worked clinical psychat, and I was working in our autism clinic and our ADHD clinic. So it was a hybrid my internship year. And for me, that year solidified my interest in the clinical setting. After you finish your internship year, you are eligible to graduate with your doctorate, given that you've defended and passed your dissertation. And then you have to do a year of residency. We call it our postdoc. And I did a postdoc in a clinic setting. So, and then once you finish your residency year, you're eligible, at least in the state of Florida, you're eligible to sit for your licensure exam. And then you can be hired by somebody. So this is my first real job once I finished all those stages of clinical work. Yes.
Okay. Yeah. And what about during your Bucknell experience? Were there any particular classes or extracurricular activities that helped you figure out what you wanted to do? And kind of like along that, is there any advice you would give to students? Because we want students of all years to be able to watch these videos and like get some advice for when they're older and thinking about post-graduation and things like that.
Yes. I think taking the initiative to spend even a few hours shadowing somebody in that specific job you're interested in is probably the most enlightening experience. At Bucknell, I think it was Professor Flack. He had a practicum experience in it was a psychiatric hospital, I believe. Was it Danville? In Danville, I think. And we got to interact with adults with some pretty serious psychiatric issues.
Mm-hmm.
I got my first patient ever with schizophrenia there. And that was an eye-opener to me. So that confirmed for me that I did not want to work with adults. That practicum did. Sometimes it's as helpful to know what you don't want to do as it is to know what you want to do. That crossed that off the list for me. So that was very helpful. I also, during my Bucknell years, I worked as a near-peer counselor at the elementary schools in Lewisburg. Gosh, I forget the name of the school. And we did counseling during the students' lunchtime. A little, like a group counseling session for children. And then we did it also at the middle school. So that was a fantastic practicum. It wasn't a practicum, it was like a part-time job. But that was a really great experience and exposure for me with the population I was interested in working with.
Yeah.
It also looked really good on my resume.
For sure.
When I was applying, sorry, something on my screen, when I was applying for graduate schools. And then probably the biggest piece that continues to help me now is doing an honors thesis, because that's really how I learned to write well. Professor Boyatzis and his red pen taught me so much. And to this day, because of him teaching me and mentoring me with my honors thesis writing and perfecting it over and over again, to this day, even my colleagues come to me for me to edit their work. Because he just put my writing at a different level, which helps me in my career. So, so doing an honors thesis is very helpful as well.
What was your honors thesis about?
Oh, my honors thesis was actually about prayer behavior. We looked at, oh gosh, I have to peel back the layers of prayer. Didn't mean to put you on the spot. People asking me about my dissertation. We looked at the different types of prayer behavior that adolescents engage in versus college students engage in. So it was pretty interesting. It was kind of a mix of religion and psychology combined. So, yeah. I remember we found that the adolescents had a lot more gratitude in their prayer than the college-age kids did at the time.
Sure.
We were asking for things. But anyway, yes.
So what does a typical day look like for you now? Like what kind of things do you do on a regular basis?
I would say, maybe I can say in a typical week, if that's okay.
Yeah, that works.
I would say in a typical week, I'll have a couple days of psychological testing where I'll do an IQ test, maybe more than one, or academic testing, or an autism test, or I'll interview children or adolescents on their levels of anxiety or depression. I always do clinical interviews with parents every week, usually multiple times a week. That helps me start out as to what are you here for? What are your concerns? And then that helps me figure out what tests to order. Do I order the IQ, the academics, etc.? Usually in any given week, I'll be doing a feedback session with a family that had tested a couple weeks ago, going over the results of testing, saying what the diagnosis is, talking about what does this mean now? Where do we go from here based on this diagnosis in terms of treatment recommendations? I have a lot of meetings every week, meetings with our clinical team. We have a multidisciplinary team here We have a developmental pediatrician that consults with me when there's a psych issue with his cases. We have speech language pathologists, behavior therapists, certified teachers, and other school psychologists on staff as well. So we actually collaborate. We have at least once a week, but we have every Wednesday we meet and go over all of our cases for the week as a team to get each other's expertise on cases. I have a lot of admin work as well because I'm the clinical director for our one of our programs, and so sometimes I hold staff meetings. Sometimes I have to see, are we meeting our quota, our numbers for the month, right?
Mm-hmm.
Are we doing enough work?
Yeah.
Yes, and then I also, believe it or not, am doing some marketing as well. Um, we kind of operate a little bit as a private practice in one of our programs, and as such, you really have to get your name out there in the community.
Mm-hmm.
So, so sometimes I am literally driving out to pediatricians' offices, or I'm driving out to guidance counselors' offices, and I'm just shaking their hands, looking them in the eye, and telling them who we are and saying what we can do here to support their kids. So, so it's a pretty big mix of activities
Mm-hmm.
throughout the week.
Oh,
Yeah.
cool. So is there anything, if you could go back and do anything differently, is there anything that you would choose to do differently, any different paths you would have taken?
I think professionally, on a professional standpoint, I have to be honest, not too much I do differently.
Mm-hmm.
Right now, I know what my specific interest is. I'm really interested in pediatric anxiety disorders. So, you know, if I could start Bucknell all over again, I think I'd focus more of my research and my essays and what have you in that area. But how is one to know that until you're in
Right.
but I would say on a personal note, what I would do differently is probably be a little less stressed. I think, you know, with the level of competitiveness
Mm-hmm.
of graduate school, but really also at Bucknell. Bucknell's a very competitive school.
Mm-hmm.
A lot of us, I think, are kind of the big fish in a little pond in high school, right? And then we go to Bucknell and like the little fish, this big ocean of other incredible students around us. And that can be hard at Bucknell. And sometimes that can promote feelings of anxiety and stress and feelings of, I think if I were to redo it, I would probably be a little more confident and more assertive in learning what I wanted to learn, and having more of a school life balance, because I think now being done with all of that, I realize now that the importance of the relationships in life and how that is number one, and career to me is just a bonus, right?
Mm-hmm.
But it's hard to have that when you're in the heart of getting your degree, have that perspective. So, yeah.
Is there anything else you'd like to share? You feel like you didn't get to talk about?
I don't think so. Maybe one more thing. If you graduate with a degree in psychology, in my opinion, it is very hard to stand out and get a decent job without moving forward and getting a doctorate degree.
Mm-hmm.
At a master's level, there's a lot of people with masters in psychology. Not that you can't get a good job, but there's so many and not as many job opportunities. I think getting the doctorate is, in this field of psychology, is really beneficial. The doors that are opened with a doctorate degree are way more than I ever dreamed of. I have so many opportunities that cross my desk almost every month, and I have to say no to them because my plate is already full. And I think that's a beautiful thing. Yeah. Yeah. So I think that's it. Is there anything else I can help with?
I don't think so.
Yeah, we really appreciate you taking the time. Your career sounds amazing. Like, I want to do that.
Well, if you ever come to Jacksonville, Florida, please call me. I will give you
Really.
Yes.
Thank you so much.
Thank you.
Thank you, ladies. Well, best wishes to you both.
Thank you.
Bye.
Bye.